I think now it's time to talk about the future of healthcare. So Dr. Somi, you join us as a physician entrepreneur, someone who is leading the way in women's health and how women are accessing healthcare. So I'd love to just start it with kicking it off to you. Share a little bit about your background, how you got into women's health, and a little bit of the work that you're doing today.
So I got the call, that was my calling, and I'm going to get emotional because my mom and my sister are both in the audience, and my father. I got a call, I was pre-med at Northwestern, and my dad said, Somi, you need to come home. My 45-year-old mother, who is now 45 now, was being rushed in for emergency quadruple bypass surgery. We lived in Cleveland, Ohio, we were insured. But she was begging her doctors. She was having left arm pain, shortness of breath, and chest pain. And apparently, if you Google her symptoms, it's caffeine or her children. That's what she was gaslit into believing. So I was like, obviously, she underwent quadruple bypass surgery and is alive to this day. And I'm going to stop looking at you, Mom, so I can get through this. And I was like, oh, this is my aha moment. I'm going to change the world. Fast forward through medical school and residency, got my first job, and man, our healthcare system smacked me in my idealistic face. I didn't have time to go to the bathroom or eat when you're seeing 50 patients a day. And so when the time was right, I wrote 3 words on a piece of paper: educate, advocate, empower. Opened a little practice in Cincinnati, Ohio called HerMD with the intention of being very provider and patient-centric, focusing on gynecology, menopause, sexual health care, and survivorship. And then I asked things happen when you ask fellow dreamers to join you in your journey. And my sister, Kamel, was working with me. And she was like, we need to scale this thing. Because we had women from 35 states and 3 countries coming to Cincinnati, Ohio. Guys, it's a nice town, but it's not known for medical tourism, okay? And then we were, 3 minority founders. And we went into fundraising. And I asked her, I'm like, what's a pitch deck? Like, literally, I'm a doctor. And they told us you have a 0.37% chance of raising. We raised $10 million in 5 weeks, 40 to date. So to scale the model, yeah.
Amazing, absolutely amazing. Let's keep that round of applause going for a second for Mom. Thank you so much for being here. And Dr. Somi, your work is obviously from a place of passion, but also a place of wanting to drive immense change. I looked at a few stats just from across the NIH, the CDC, World Health Organization before this conversation, and I want to share a few with the audience. It's just kind of level set where we're at in the world and what we're still dealing with as women. 19% of women say that their doctors do not explain things in a way that makes sense or directly relates to women's health. 19%. I think that's probably a lower stat. Not often do we want to admit that we don't understand things. 10% of women report that they've been discriminated against by their provider based on their gender or sex. 29% of women report that they felt like their concerns were ignored or dismissed when raising issues to their provider. 2 more stats for you guys. 2/3 of women, 66% of women between the ages of 40 and 64 report that their provider has never talk to them about menopause or what to expect during menopause. And to add all of that together, the CDC reports that 48% of women above the age of 20 are consistently battling hypertension on top of everything else. Dr. Somi, you've been in this space before this space was mainstream. You've been doing this work before it hit headlines. Tell us, what are we getting right? What are we still fighting?
Yeah, so last year we lost $1.8 billion because of menopause-related symptoms that we left the workforce for, whether we were worried about incontinence and there wasn't a bathroom on our floor or worried about brain fog. So we're losing money And we're spending 40% of our lives in menopause and graduating less than 30% of doctors who are trained to deal with our health for 40% of our lifespan. If this was a male issue, we would have already figured this out. Seriously. And we have historically been treated like a footnote in men's health. So what are we finally getting right? There was an over 50% increase in VC funding in women-led startups, but that total number is still 2%. We have celebrity voices who are saying no more. We have events like this where there's now packed houses when you talk about women's health care. There's more data, there's more research, we're hearing about it on the Hill. So those are the things that are making me super excited. There's a great documentary out. The number 3 bestseller is about menopause. I did not think I would ever see that in my lifetime. So all of our collective voices are gonna finally be the change that we all so desperately need, because otherwise we are going to die. I'm so tired of hearing it's a lifestyle issue when it's a women's healthcare issue. My mother, if her heart attack would have come, she would not have survived. Heart disease is still the #1 killer of women in this country, and we are more likely to die of a heart attack. And this is the other really sad thing. Do you know your outcome is dependent upon the gender of your rendering provider? Meaning you are more likely to die if you have a male physician versus a female physician. That is a huge problem.
You know, you mentioned that it's a big conversation point right now, and you've been all over the world, South by Southwest, Health, I believe ASCO as well, several, every industry conference we can think of, you've been speaking at, raising these issues, and there's still folks who are saying it's a lifestyle issue. Mm-hmm. It's a one part of the population only issue. They're dismissing it still. How are you handling those conversations? How are you fighting back against that?
So that is where you create a team of like-minded individuals who can write the checks, use their platforms. I don't want to hear anymore, there's no data. We at HerMD have produced a lot of data ourselves. And so all of the people and all of the different verticals together, working together, and just saying we're not going to tolerate it, and really training patients to say no more. Because if they demand the change and understand that they deserve to be the CEOs of their own health, we won't have to tolerate this anymore.
Indeed. Somi, you have mentioned HerMD briefly, and the need for more organizations like HerMD or a bigger collaborative to support HerMD and really make sure that those statistics that you've shared about the gender of your provider impacting your health outcome is changed, that negative statistic is eradicated, more women have access to the right level of healthcare at the right time. Can you speak a little bit about, the work at HerMD, what led you to creating that from a process standpoint, and how you've set the model up in a way that actually puts women first?
Well, I put together a business model with my sister and people who had done this before, and I couldn't find an open door. I had hospital systems telling me it was never going to work because I wanted longer appointment times, because time is the devil. You cannot talk to your doctor, get rapport, do everything in 5 to 7 minutes. How in the world are you supposed to accomplish anything? And so we didn't have enough leadership, data, research. So I was like, how do I create a patient-provider-centric model, longer appointment times, no call, and really focus on gynecology, menopause, sexual health, train them, come up with a training program, HerMD University, because yes, it's great, we're going to teach in medical school, but those doctors aren't going to be out for a minute. Who is going to take care of the 1 billion individuals in menopause now? And so we created this university system where we trained all of our providers. So you got an expert, whether they had a social media following or not. We had incredible outcomes. And then we proved out our outcomes and presented our posters and shared our data at major medical conferences. And so that is how we really differentiated ourselves. And I really believe a healthcare company needs physician leadership, because we are the only ones who understand what it feels like to be both in the boardroom and the exam room, and really be the advocate for the patient and what it's like to deliver that news I'm sorry, but I can't give you that medication because your insurance won't cover it. To have those conversations, to hold those hands, to look in people's eyes, that is a very unique perspective. And when I first started, I had imposter syndrome. I'm a doctor. But I learned that no one knows the patients like I do, and that I had to be a voice for them in these rooms, just like I was a voice for my mother when I was only 21 years old. And I kept that promise to her and to myself.
You know, one of the things that you mentioned is the insurance side. We can't give you this medication because the insurance won't cover it, right? Let's put that into perspective for a second. About 10 years ago was when most major insurance players actually started to write in menopause coverage, sexual health coverage, gynecological coverage. Prior to that, you had to be with a really good employer to maybe have a carve out for that type of care. In perspective, the Blues Association, so all of the Blue Cross plans, the big blue players, they've been around for 92 years. And only in the past 10 have we focused on women's health as something that you can actually get access to without potentially going bankrupt or being told that you're not able to have care or that medication for a certain care. Talk a little bit about your experience of pushing that pace of change, because there's been a lot of work in the past 10 years to make this happen. And I think organizations like yours and leadership like you provide has been pushing the charge there.
Yeah, there's a huge gender disparity when it comes to even drugs that are available. There's over 26 medications available for men's sexual health care in this country, only 2 for women. Viagra was fast-tracked, considered a national emergency, and it was approved in 6 months, okay? The first ever female sexual health care drug took 6 years to get FDA approved, and less than 1% of the population knows about it. Less than 5% of providers still know about it, and it's been on the market for 10 years. So who knows what Viagra is? Be honest, right? Okay, anyone heard of Addie? Wow, and you guys are, yes, we're at a healthcare conference. And that's not shocking. So Addie was the first ever FDA-approved medication for low libido. I was part of the team that went to the FDA to advocate, to tell patient stories about the need that women are losing their marriages. If you talk to menopausal women, about 80% attribute loss of their marriage due to menopausal symptoms, and a lot of it presents like low libido. Another problem with insurance and this gender disparity is, let's take urologists, for example. They're trained in male and female health and sexual health. But if you look at most urologists, why is their patient population 80% men and about 20% women? It's not because they like the dudes better. Any idea? Insurance pays them 3 to 1. So if you take a male procedure and a female procedure, they're going to get paid 3x. And so at the end of the day, they have to pay their bills, they have to pay their staff, they have to pay back their med school loans. So it incentivizes them to take care of men versus women. And so by collecting data at HerMD, presenting posters, we did things like take them back to the insurance companies and say, look at our outcomes, look at our data. And we were able to negotiate higher insurance reimbursements, but through data.
Speaking of data, we've talked about the manual labor, the boots on the ground fight that you've had to fight for years at this point, and everybody's still fighting. We've talked about tech throughout the conversation today in various different settings, and we're not going to stop talking about tech. And obviously, there is an area for tech within women's health as well. Speak a little bit about the use of AI, the future of tech, what we could be doing now, and what we could be thinking about for the future of using these tools to really advance this conversation.
So I love femtech and I love innovation and I help so many companies I consult. But what I still see this huge discord of, we have all these wearables and all this data, and I love that because that allows a provider and a patient to take this information and help them make a curated plan for their healthcare. Like your sleep data, your hormones. But what I don't see is I see all of these beautiful innovations like smart tampons and wearables for endometriosis pain. But then you go to our clinics and our hospitals, and by our clinics I don't mean HerMD, but women's healthcare clinics, and you don't see it because it's not accessible. And so I see all this innovation, but I don't see it yet in the hands of patients. So that makes me sad. But what I love is all this innovation is happening. In the future, what I would love to see are two things. I don't think AI is going to replace gynecologists, or doctors in general. Although the at-home PAPs are now available with a company called Teal. What I do think is those that use AI or AI-powered physicians, clinicians, are going to replace those that don't. Kind of like when we saw electronic health records coming in and a lot of people retire, they're like, yep, I'm not doing this. So there is so much that you can do with AI to really empower the patient and help them be the CEOs of their own health. Because in this country, I truly believe if we're going to move towards longevity, and the other statistic is even though women live longer, we live in much, much poorer health. I want to be climbing mountains at 80. I do not want to be sick. I don't want to live a very long, prolonged sick journey. And that's what's happening to women in this country. Men usually die acutely at an older age. Women will live longer, but in much poorer health. And I believe through wearables, through femtech, through innovation, through data, through AI power, we will be able to finally catch up with this huge gender disparity we have right now in healthcare.
Dr. Somi, we've got a room full of folks across every industry you can imagine, every background you can imagine. Leave us with one thought that we should all be taking forward as we think through women's health, our own health, and what we can be doing to continue to advance this work.
So I'm a dreamer, and I had to get through that and through that imposter syndrome. And so what I would tell people is surround yourself with the magic makers, the believers, the dreamers, the innovators, and do not take no for an answer. The time is now for women's healthcare, and the revolution is happening.
The time is now. Perfect.
The time is now.
Dr. Somi, thank you so much.
Thank you.